Even as many parts of the world start to open up again, frontline workers are struggling to cope with the silent toll of the COVID-19 pandemic, burnout.
And now all our recent studies on health workers and other frontline workers suggest that burnout is increasing, anxiety is increasing, and so we expect that the rates are going to kind of stay high for public servants for a while.
There are some intensive care unit staff saying they've reached a breaking point.
From academic research centres to scientific journals, health workers and scientists fighting the pandemic say they are hitting a wall. I know some healthcare workers who've thrown in the towel and taken up a completely different job. Main thing, stay sane. For the doctors and nurses who can soldier on, there's still a lot of work. There may be light at the end of the tunnel, but the crisis isn't over.
A taste of normality can be felt all over Madrid. The city's vibrant nights have recently been approaching what they were before the pandemic. Bars and restaurants are busy. Since Spain lifted the state of alarm, bars and restaurants have steadily extended their hours. Curfews have largely been cancelled. Non-essential travel between the regions is allowed again. The lifting of these restrictions was met with wild celebrations in the streets of Spain. That outraged many Spaniards. Infection rates across Spain are dropping, but here in Madrid they're still higher than elsewhere, and hospitals are especially feeling this pinch. Intensive care staff say that their beds are occupied. After more than a year, they're at breaking point. Some are even quitting their jobs at the COVID ward. This is why people we speak to are cautious. They want to enjoy their new freedoms, but also do so responsibly. Juan David Fuertes Garcia hasn't seen his family in 9 months because of Spain's travel bans. He is planning a long overdue visit. Now that they are opening up, we really want to see each other, but we're also scared. Our case is special because my father died last June from COVID. Although his mother is already vaccinated, Fuertes Garcia will still take every precaution to make sure his visit home will be safe. It is what it is. The virus is there, even if restrictions are eased. But it's true that the easing of measures takes a weight off your shoulders. It gives you freedom to a certain degree. Bar owners like Simón Alfaro are optimistic that such freedoms are here to stay. Businesses in our sector that live from one day to the other cannot afford to close. But I am confident that by the end of the summer the situation will have improved, whether it's social and nightlife or everything else. Until then, Spain will try and enjoy this fragile life, hoping that millions more people will get the vaccine and that coronavirus variants can be kept at bay.
Europe and parts of North America are starting to reopen, but that has many employees worried. One survey shows that nearly half of workers could leave their jobs in the coming months, with 66% of respondents saying they feared that workplace safety measures were being lifted too soon. Unsurprisingly, healthcare workers and researchers are some of the most affected by COVID stress, 1 in 5 saying they were considering leaving the field when the crisis is over. Desiree Dickerson is a clinical psychologist and academic mental health and well-being specialist. She joins us from Alicante in Spain. Just what sort of a burden, first of all, are these medical workers in particular carrying?
Well, in particular, it's a huge burden, right? The weight of I guess the world is looking at them. How are they able to help our grandfather in hospital in this moment, holding people's hands when they can't have family to support them? How do they deal with just the increased burden? I've heard stories of people of medical professionals who have signed more death certificates in a day than they had in their work life. Wow. To that point. This is incredibly impactful on those at that coalface right now.
So how should those doctors and nurses be dealing with this sort of situation and this huge burden?
Well, it's very easy for me to say from the comfort of my office, my enclosed office, without having to wear a mask or anything like that. But I suppose it would be, my 2 cents would be to take it back to sort of those the smallest possible changes that you can make in the moment, right? That pause and breathe, that pause just to reset yourself, reset even your posture, recognize that those physical sensations that you're experiencing feed into the level of stress, the level of overwhelm that you're experiencing at any point in time. So just resetting your breath through that diaphragmatic breathing, if you like, resetting just your posture and finding that point of tension in your body can be useful in those moments, and just keep it in the moment if you can, right? Just rather than zooming out and looking at all that you are dealing with over time, but just the person in front of you and how you can help.
Your work concentrates mainly on academia. How much of a problem is burnout in academia, and how has COVID made it worse?
Well, I guess if you consider the sorts of things that drive burnout, it's not really surprising that burnout's a huge problem in academia, right? Increased workloads, really high workloads, relentless pressure to publish, really, really little work-life balance are big drivers. But then if you consider the scientists, even those working around the clock to provide us with everything that we know about the coronavirus, all of those predictions and those models that are driving governmental policy, the science that's allowed for this rapid development of these life-saving vaccines, many of these incredibly talented individuals are on short-term contracts with no idea whether their lives, what their lives will look like, where they'll be living in the next 2 years' time. That's a huge degree of job uncertainty, and that's incredibly stressful, right? COVID has then increased their workload. At times, 3 times the working load, because of their teaching load has shifted significantly to move them online. It's reduced any of that ability to collaborate and network with our colleagues and to build and to share on those scientific ideas. And many of them are doing it at home with kids asking for snacks every 2 minutes. Yeah. It's hugely increased that rate of burnout in our academic community, for sure.
So do you have any advice for them in preventing that burnout in the first place?
I guess first and foremost, it's really recognizing that burnout is a problem not of the individual, but of a system, right? The system needs to change. But that said, obviously there are things that individuals can do, and that's where I suppose I spend a lot of my work is there's things that we can do to protect ourselves against it or to manage it when we're experiencing it. First, with academics, is just don't internalize it. This isn't a sign that you're not cut out for academia or that you're not good enough. Those thoughts stop us from putting our hand up and asking for help. It would be focusing on the things that you can control, right? You might not be able to change that lack of job security right now, but you can work on managing your worries, your fears, how much they keep you up at night, how much they stop you from concentrating. And again, just making the smallest possible changes, those micro changes that could set you on a healthier path today, right? It might be towards sleeping better. It might be towards moving a little more. It might be just permission to breathe and do nothing, disconnect for 5 minutes.
Briefly,
and I suppose if you are in... I'm sorry.
I was just going to ask, what about a big change? What about something like, because I was reading a lot of employees would like to move towards a hybrid model of work to reduce their stress. What do you make of that?
I suppose in some ways it's been really beneficial, right? If you don't need to be in the lab as a scientist or whatever, then being able to work from home has provided a degree of flexibility that many are enjoying. But to be honest, academics at least, and many of us, right, are not very good at delineating between work and life and finding that line in between. And if you are now doing that from home, it's even harder still. So how do you find that line? How do you close that laptop and not just check emails in the evening? Work is intruding on our lives. And especially in COVID times when you don't have all of that life outside, your friends, your family coming and claiming some of that work time, then you're just working more, right? You're just able to fill that space, and it's hurting us. It's hurting us a lot.
Desiree Dickerson there for us, a clinical psychologist, and a bit of advice there if you're suffering from burnout. Great talking to you.
My pleasure. Take care.
Here's another interesting question for our science correspondent, Derek Williams. If you've got one yourself, send it to our YouTube channel.
I took an antibody test after vaccination and it was negative. Shouldn't it have come out positive?
No, not necessarily. The Food and Drug Administration in the US actually issued a communique on exactly this topic just a few days ago. It says that although COVID-19 vaccination might cause a positive result in some antibody tests, it doesn't necessarily do so for all or even for most of them. That sounds a little counterintuitive, I know, but it isn't really, for some simple reasons. One in particular, which is that most antibody tests weren't designed to detect immunity after vaccination. They were designed to detect a past infection with SARS-CoV-2. And although both vaccination and infection lead to the same result, which is immunity for at least a while against the virus, it turns out that at the immune system level, things are a little more complicated. Surprise, surprise. To explain what's going on, let's look at the structure of SARS-CoV-2 for a second. From the outside, it looks like a ball studded with weird feathery structures. The ball is what's called the capsid, which encases the virus's genetic material. Together they form what's called the nucleocapsid. The feather-like structures that dot the surface are called spikes. Now, when you contract COVID-19, your body reacts with a range of antibodies that attach to a range of different targets, lots of them on the nucleocapsid. And those are the antibodies that many tests are developed to detect. Most vaccines, however, work by getting your immune system to produce only antibodies that target spikes. And plenty of tests weren't made to detect those. So if you've only been vaccinated but not infected, and you take one of those tests, then it'll come up negative because the test was made to detect nucleocapsid antibodies and not the spike antibodies that your vaccinated system is producing. But they protect you effectively too.
Thanks for watching. Stay safe and see you again soon. Bye-bye.